Hi, I'm Dr. Ramachandra from Sri Sri Holistic Hospitals at Nizampet Road in Hyderabad. We'll just talk in short about why the Indian population suffers from the menace of heart attacks and how to prevent it. As you all know, India is the global capital for heart attacks. No other country suffers from so many heart attacks as India does. So we are the global capital for heart attacks, diabetes, and most probably for high blood pressure also. All these three diseases are man-made diseases, which means they are not natural diseases to happen. We look at the main causes of heart attacks. And what is a heart attack? Basically, the heart is a muscular pump, and it pumps a huge amount of blood, maybe more than a water tanker every day. And it circulates the blood all throughout the body, so that every cell has a transport system supplying blood, supplying oxygen, and so many nutrients, and then removing the toxic matter. So this is what the heart does. It's basically the pump that supplies blood all throughout the body. It's a muscular pump and it's a hardy organ, which means it's not going to stop, or it's not going to moan and creak and stop working all of a sudden. The heart is a very hardy organ. It's a muscular structure that keeps pumping blood all throughout the body. It has no rest. Does this function day and night all throughout the life. For it to function so well and for it to keep on pumping the blood, it itself needs a lot of energy. And this energy comes through the blood just like any other cell in the body. Now this blood to the heart is supplied by three small tubes called coronary arteries. Guess what is the size of these arteries? Just 2 to 3 millimeters in diameter, which means they are the diameter of your ballpoint pen ripple. Now, to prevent blood from clotting in these tubes, heart needs a lot of blood to keep pumping all throughout the life. And this blood is supplied by three small tubes, which are called coronary arteries. Guess what is the size of these tubes? Just 2 to 3 millimeters, which means they are the diameter of a ballpoint pen rifle. Now, to prevent blood from clotting inside these tubes, there is a layer of cells called the endothelium, whose function is to prevent blood from clotting. Now, over many years, starting from age 2 onwards, cholesterol starts depositing in these areas and starts producing what is known as plaques. These are cholesterol plaques. The main deposit here is a matter called cholesterol. Now, when the plaque becomes flow restrictive, which means it is more than 70 to 80, it has narrowed the lumen more than 70 to 80%, only then does the person starts getting symptoms because of less blood supply to the heart muscle. This happens when the person usually exercises. When the person exercises, the heart itself pumps faster and it needs more blood supply itself. And when there is a narrowing in the tube supplying blood to the heart muscle, and when the heart needs more blood supply, this behaves like a half-closed tap, and there's not enough blood going to the heart muscle, and this is experienced by the patient as angina. Angina is typically a central chest pain, which means it's neither to the left or the right. It's usually a central chest pain. It's not a sharp localized area, but it's in a broad area. It is more of a compressive and a tightening sensation rather than any sharp pain, and it sometimes might radiate up into the neck and especially into the jaws, and then it might radiate also on the inner side of the arm right up to the little fingers. Sometimes this pain is sort of localized in this area, in this joint area also. Now this angina usually happens when the person is exercising, and if he rests for a couple of minutes, then the heart also, the rate at which the heart beats also slows down, the heart itself needs less blood supply, and the pain goes away. So typically, if a person is getting pain anywhere in the body between the earlobes and the navel, and if this is happening during exercise, and if he rests for a couple of minutes, this pain goes away, then you should suspect that it could be angina. Now the same type of pain, when it happens at rest and when it doesn't go away in say half an hour's time, and when it is associated with sweating or giddiness, or the person falls down, or breathlessness, then you should suspect that the artery, the tube that is supplying blood to the heart muscle is completely shut down and producing what is called a heart attack. So basically the symptoms of angina and the symptoms of heart attack are quite similar. There is sort of central chest pain with these sort of typical radiations into the left hand or the inner side or into the jaw. But in a heart attack, the pain doesn't subside with rest, and it is usually associated with sweating, vomiting, breathlessness, or the person might even fall down. Now this is what happens in a heart attack. As we saw, this was what was narrowed down. This is the lumen of the coronary artery, and then because of the cholesterol deposits, the lumen got reduced. But heart attacks are always sudden. A lot of people ask, why are heart attacks sudden when cholesterol, it takes years to get deposited? The reason is heart attack is because of clotting in this area, and when it clots, the artery is completely shut down, the blood supply is totally shut down, and that's when you get a heart attack. Now many times, you don't need severe narrowings in these tubes to produce heart attacks. It's more of a clotting problem than a cholesterol deposition problem. So here you can see this is a cross section, a cut of the heart artery called the coronary artery. The cholesterol deposit is here, which produces maybe a 30 to 40% narrowing of this lumen. But what happened because of mental stress, or because of diabetes or smoking, whatever the other reasons might be, the endothelium, or the layer that prevents blood clotting, which is on the inner side, it cracked here. Can you see here? Here there's a crack. Then blood came in contact with this material and the whole thing clotted. Like we discussed, the endothelium, or the inner layer, has to be intact. The function of this layer is to prevent blood from clotting. If there's a crack in this membrane because of the pressure of cholesterol, or because of smoking, diabetes, or mental tension, then blood comes in contact directly with the material underneath, and then it might clot, producing a heart attack. So basically an heart attack happens when cholesterol is deposited slowly over years together, over decades together, but then the blood clots suddenly because there is a rupture in the membrane that prevents blood from clotting. That's why heart attacks are always sudden, and that's why they are called attacks. Sorry. Chapna? The coronary arteries, or the arteries that supply blood to the heart, can be visualized by a test called coronary angiogram. In an angiogram, there is a small tube that we put through the artery of the hand or through the groin, and this directly hooks on to these vessels, these tubes that supply blood to the heart, and when you inject dye or this dark colored substance, you can see the inside of the tubes. As you can see here, these are the three tubes. There is one going to the back, there is one going to the front. So as you can see, there is one going to the back, there is one going, the one going to the back, one going to the front. In this case, there is one going in the middle also, and usually there is one on the right side. So basically you have an artery supplying the front of the heart, one supplying the back, and one the right side of the heart. So basically three of these arteries. These are not as big as they look here, they're sort of magnified. Like I said, they're just 2 to 3 millimeters in diameter. Stop. This is an angiogram of a person who has a heart attack in the right tube. As you can see, this is the starting of the right tube. You're injecting dye and it is blocked here. So that's an heart attack when this thing gets blocked. Now the treatment of heart attacks are twofold. One is you can give a substance that dissolves the clot here, which is a clot busting substance, or you can directly do an angioplasty. In an angioplasty, what is done is there's a wire that is put across the block. As you can see, there's a wire going down across the block. Once the wire goes, usually there is some flow that is again starting, the blood starts flowing, but there's a tight narrowing there, which is a cholesterol block plus some amount of clot. And the clot can sometimes be sucked out, or as in this case, you just put a stent or what is a sort of a small metal mesh that keeps the artery open. As you can see, that's the stent going in between those two dots. And then the balloon in the stent, within the stent is inflated so that the mesh gets opposed to the vessel wall, and then the balloon is removed. As you can see, that is the mesh there. That's the balloon inside, which is later on removed, and the mesh stays there lifelong. So that's what, as you can see now, that when we're injecting the dye, the whole thing is filling nicely. So the artery that was blocked has been opened up, and this is called a primary angioplasty. So the preferred mode of treatment, mode of treatment for heart attacks is what is called primary angioplasty, wherever there is a cath lab. So you take the patient to the cath lab, do an angiogram, and then the artery or the tube that supplies blood to the heart is blocked. You open it up, put a stent or a mesh that keeps it open, and then you ensure that the blood flow going down is good. So right in front of your eyes, you're seeing that it's opened up, and this happens within half an hour or so. The other option where there's no cath lab is to give a clot busting medicine to open up those arteries. Usually, if the patient comes to the hospital within 2 to 3 hours of the onset of pain, the clot busting medicine will work almost as well as the primary angioplasty. But as the time increases, say a person comes with a heart attack of a duration of 6 hours, 8 hours, 10 hours, the clot busting medicine may not work at all. That's why time is muscle, because in heart attacks it is said that time is muscle, because within 6 to 12 hours the heart muscle, if it does not get blood supply, because the heart has to keep pumping whether it gets blood supply or not, it works itself to death. So the heart muscle dies, and the heart muscle dies permanently. Unlike liver, the tissue is not going to regenerate back. So it's very important that as soon as you have, or a person has pain that we suspect could be a heart attack, it may not be a severe pain, but it is usually, like we described it earlier, in those particular locations, then we have to immediately rush to the nearest hospital and take an ECG. Once the ECG is done, if there is a heart attack, then the treatments that we discussed needs to be done. So what are the emergency measures? Many people ask, what are the emergency measures that the person should take when he suspects he has pain? Actually, there are not many emergency measures, and they give you a false sense of security. The only emergency thing, the right thing to do, is to move the person without much stress, which means if he is having severe pain, let him not walk around and get stressed. Somebody else should arrange the transport immediately to the nearest hospital. You don't need to go to the best hospital, which is 20 to 30 kilometers away. No, that's not the thing. You need to go to the nearest hospital that can take an ECG, and now of course the ECG can be transmitted by WhatsApp and other means wherever you want, and get an opinion on the ECG whether the person is having a heart attack or not. That is because the more time you lose, suppose you lose 3 hours or 2 hours in transporting the patient to a hospital that that time lost might kill the person. So what are the causes of heart attacks? There are 3 main causes. One is the food that we consume. The second thing is the exercise that we do not do. The third thing is the mental stress that we are all subjected to. So these are the 3 main things. If you want to look at the biochemical factors of the blood tests or something that will tell you, we can again say that it is because of high cholesterol, high weight or obesity, high blood pressure, and lack of exercise. So these are the main things. If you want to look at the tests that will predict a heart attack or the measurements that will predict a heart attack, these are, you can remember, 4 highs: high weight, which is obesity; high blood pressure, which is called hypertension; high sugars, which is called diabetes; and high cholesterol, or whatever you might say, low good cholesterol, high bad cholesterol, which is called dyslipidemia, or high cholesterol. So these are the 4 main things. To add to this, you have smoking and lack of exercise, lack of green leafy vegetables and nuts in your diet. Mental stress is, of course, a major cause of heart attacks. So these are the usual things that produce heart attacks. Now, can we really predict heart attacks? There was a very large study called the InterHeart study, and they found that they could predict 80 to 90% of heart attacks, not based on any complex tests, but based on these simple risk factors that we discussed before. These are called risk factors for heart attacks. To go through them again: high weight or obesity, high sugars or diabetes, high blood pressure, or what is called hypertension, then your cholesterol, the lack of exercise, mental stress, and lack of fresh vegetables, nuts in your diet. So these are the main things that produce heart attacks, apart from, of course, your family history, which is also very important. If you have a lot of people in your family that have heart attacks at a very young age, then you definitely need to meet a doctor at a young age yourself, maybe between 25 to 30 years, and find out why all these other people in your family had heart attacks. How to prevent heart attacks? The way to prevent heart attacks is, number one, by having proper knowledge about it. Like we discussed, we need to know what are the causes of heart attacks. Once we know that there are these around 4 to 10 causes of heart attacks, you can take steps to avoid these risk factors. The main things that we do is, if we think there are 3 risk factors: lack of exercise, the food that we eat, and the mental tension that we are subjected to, we need to take steps to counteract these problems. So number 1 is exercise. Now, exercise increases your longevity, the number of years that you live, by 10 to 20 years. So it's a tremendous tool to live longer and live better. Now, how to exercise for cardiovascular fitness? You need to maintain a particular heart rate, which means it's called target heart rate, which is 220 minus your age. You can count it by the pulse or by many other devices that are there nowadays. So you should maintain, for example, I'm around 50 years, 220 minus 50 for me will be around 170. I should maintain at least 80% of this heart rate the whole period, the 45 minutes of exercise that I do every day, which means unless I walk very briskly or I'm running for that 45 minutes, I will not get cardiovascular fitness. The analogy is, when you're working hard, when your heart is beating fast, these tubes, the muck in these tubes gets washed away by the flow of the blood. So in case you can't take your pulse, if you and your partner are walking side by side, you should walk fast enough so that you are breathless and you're not able to complete a full sentence to your partner. So that's the way to get cardiovascular fitness. The basic message is that it should be brisk. The exercise should be brisk to get cardiovascular fitness. And you need to do for around 45 minutes every day for most of the days. So this is how you exercise. And the other key element is that you should relax, mentally relax during the exercise. If you're getting tense during the exercise, it will be counterproductive. So if you can't really do it, you can play a game or something that you will relax while you're exercising. The second thing is about diet. The 2 main things that we're interested here, the fats and the carbohydrates. Much more important than the fats are the carbohydrates. The main reason for this increase in diabetes and heart attacks in the Indian population is the white rice that they consume. For many years, if you look 50 years back, there were no rice mills that could polish rice. So once these cereals started getting polished, all the outer covering was removed. The only thing that was left in the kernel was a very starchy thing. And once you consume these huge amounts of starch, what happens is the body starts producing more insulin to counteract it. And this produces a diabetic tendency. You may not be diabetic, but it's a diabetic tendency. This is called metabolic syndrome. Metabolic syndrome is when you have a tummy that sticks out, your blood pressure is slightly elevated, more than 130 by 85, your blood sugars, fasting blood sugars are more than 100 milligram percent, your triglycerides are high, it's a component of your cholesterol, and your good cholesterol, HDL, is low. If you have any 3 of these 5, you have metabolic syndrome. and that's the commonest cause of heart attacks in India. And this is produced by this increased amount of intake of starchy foods. The main thing is white rice and whatever you make out of this, these polished cereals. So it could be white bread, it could be noodles, or your idli, dosa, upma, and all these things. So this is the main thing. So how to counteract it? Very easy. Take cereals, it's a good food, but don't polish it. So very easy thing, how to manage, how to get out of this situation. The other thing is, of course, take a lot of nuts, take fresh leafy vegetables, and cut down on processed food matters. So that's about carbohydrates. Third thing, which is most important about carbohydrates, is the amount that we consume. Because we are now exercising less and less, we need to consume less and less. So many people ask me, what is more important, how much you eat or what you eat? I say it's how much you eat. You eat less and you live longer. It's as simple as that. The other thing is, of course, the oils. We are all very interested in fats and the oils that we consume. The main fats that Indians consume is coming through the oils, and we are the largest importer and consumer of oils in the world. So what type of oil should we use? More important than what type is how much and how you use it. Number one, any oil that you use, if you are going to use it for frying, it gets converted to something called trans fatty acids, which is very dangerous for the heart arteries. So number one, the oil should be used without frying. You can put it in your rice and dal, or you can smear it over the roti after you baked it. So you take the oil directly without frying. So what oil is best? Something called monounsaturated fats are best for the Indians. So these are basically olive oil, canola oil, even gingerly and things like that, rather than sunflower oil. Now what these monounsaturated oils do is they increase the good cholesterol, which is the main problem with Indians. What the polyunsaturated oils do, just like sunflower oil, they decrease the bad cholesterol, but at the same time they might decrease also the good cholesterol. At least they do not increase the good cholesterol that well. So that is the reason why we prefer these monounsaturated oils. The other thing that you need to know is 1 to 2 tablespoonful of oils has a lot of calories, so you cannot consume too much of these oils. The natural way to get oils is through nuts. The American Heart Association recommends 40 grams or 50 grams of nuts every day. So the best nuts are almonds and walnuts, and of course any other, even peanuts are also okay because they contain a lot of monounsaturated fats. And of course you have to take them without frying them again in oil, or even without oil. It's best to take them sort of raw. The reason for heart attacks in this country and all over the world is mental stress. So a lot of people are continuously under some sort of mental stress, and when you're continuously into something, you fail to notice it at all. So that's the problem. Many of us claim that we are not under any stress, but most of us, 90%, are under mental stress. The best thing to know if you are under stress is to do something to get out of stress. If you can do pranayam, or you can do some sort of kriya or meditation for half an hour every day, and you do that for a month, then you know what is relaxation, and then you know that how you are stressed under normal circumstances in life. The key is to separate yourself from your thoughts, and when that happens, you can really relax, and this has tremendous benefits, and this has already been researched. For example, All India Institute has published a small study where they have used Sudarshan Kriya, and they found that the good cholesterol, the HDL, was increased by around 10 mg/%, which is not possible with any drugs. There are a lot of brain mapping imaging also done after this Sudarshan Kriya and other Kriyas like this, and they have found that the front part of the brain is as if the person is in deep attention. The back part of the brain is as if the person is in deep sleep. So this is a state that is possible. You're deeply relaxed, at the same time you're deeply concentrating or at attention. So this is something that is possible with the human brain. And so this is our own age-old tradition, yoga, pranayam, meditation, and this is what we need to use. At least do it for half an hour every day to get out of mental stress. There are 4 components of the heart. One is the blood supply of the heart, which we discussed. The main problem here is when the blood supply stops, the person has a heart attack. There's the muscle itself, which can be directly involved. This is the electrical system of the heart, which is a very interesting part of the heart, because the heart has to beat as many times as it gets electric supply. And the fourth thing is there are valves, or like you have valves in a motor pump, you have valves that cause unidirectional flow of blood in the heart. So all the diseases are there that can affect all these four components, and we discussed just one of them, the most common, of course, and the most preventable cause of death on this planet, which is heart attack. Now, heart attack is not a natural disease, it's a man-made disease. There are a lot of natural tribes like Eskimos and others that never have heart attacks. So this is what we need to know. The best way to prevent is through education. In this hospital called Sri Sri Holistic Hospital, this hospital is named after Sri Sri Ravi Shankar, and we actually put in all those therapies in yoga, Ayurveda, meditation into all of our preventive programs, including the routine checkups. There's a small meditation capsule which is given free around 5 to 10 minutes so that people can meditate and find out how they can relax. We also try to put most of our heart patients through a cardiac rehabilitation program that has these active meditation and yoga programs. For example, obesity. There's a very nice obesity program which is mainly based on Surya Namaskars, and it works wonderfully. So these are all natural techniques which can be put in any hospital, anywhere. It doesn't cost anything, which can be applied on a universal scale also to a large amounts of population in a very easy manner.